Whiskey 9, 7 November, interrogative Alpha Bravo. Negative Alpha Bravo. And this is 7 November Golf, Roger. Request you check your Romeo side. I'll go ahead and check my Tango side. 7 November Golf out. 7 November 8 and 8 Class 7 November, say again. 7 November, go. I copied a while ago, 1 Charlie transmission that my thing used, and 8 5, this is 7 November, Charlie. 8 5 right now. Now 1 Charlie, 7 November, go.
This is 1 Charlie, welcome to your last, you're Brandon 158, enter box 1200 between teams, that's local. Also request 3 units take inbound Nexus to see if we can try to get Whiskey 9 and 8 for pause to the playground.
And this is 7 November, Roger, stand by.
Got that.
Got it? Alright. And all units, this is 7 November Golf, my unit Alpha, Echo, X-ray Alpha Alpha in there.
One Charlie, Alpha Bravo.
Hey, I never took a dip. I forgot to take a dip.
Whiskey 9, 7 November, interrogative Alpha Bravo. Whiskey 9, Yankee, 7 November Golf, over. This is Whiskey 9, go. Whiskey 9, 7 November, interrogative Alpha Bravo. Whiskey 9, Yankee, 7 November Golf, over. This is Whiskey 9, go. Whiskey 9, 7 November, interrogative Alpha Bravo. Negative Alpha Bravo. And this is 7 November Golf, Roger. Request you check your Romeo side. I'll go ahead and check my Tango side. 7 November Golf out. 7 November 8 5, and 8 Class 7 November, say again. 7 November, go.
All right, welcome to the live stream. We have access to a VA employee only. It goes big here in a second. It won't be that small forever. VA employees already watched this. Okay, I assume they got paid for watching this. That'd be pretty cool. But we get to see the VA secretary speaking directly to VA employees, which is it's a different tone. All right. So bend over, hilarious. What's up? Jeffrey, how's it going? Sherry, how's it going? What's up? Yep, this is starting right now. Just saying hi to everyone. Yep. Here we go. There's Kish. Nice. Bend over again. Next level. It's a long time seeing you. Guy Tate. So here we go. National Work Queue Purgatory. Yep. Purgatory would be a good way to, what's up? How's it going? To explain it. Anyways, I'm going to stop talking and let's see what the VA secretary has to say. Again, I started it small. It'll go big here in a second. This is recorded earlier today. It was 2 p.m. Eastern. So here we go.
Hello, everyone. Thank you for tuning in to the Secretary of VA Town Hall. I'm Ron Haskell, the comms guy here at VA. I have the honor of being your
Can you hear that?
moderator today. We've got an exciting and informative program lined up for you. Earlier this week, we asked for your questions, and you all delivered in a huge way. We received nearly 7,000 questions. Huge thank you to everyone who took the time to share their thoughts and queries. We've gone through
Oh, I didn't even think about the volume.
Later on, we'll tackle topics like the return to office, thought process behind a potential reduction in force, our efforts to cut through layers of bureaucracy, what veterans and employees might expect.
Okay. If you have to turn your volume all the way up, I'm just going to mute myself. Then when I pause it, just so you know, I'm coming back on. So here we go. Okay, so I can't mute my mic. My mic has to be on. Got it. That makes me curious if... Dude, this would totally suck if it doesn't work. Okay, we'll try it again. Hopefully it works this time.
Things that I've been trying to do. I promise from almost my very first video that I announced, I was here, I was in the office, got sworn in, was that we're going to be, someone's going to communicate, that you wasn't going to have to really worry about what we were talking about, where we were feeling, and we wanted to do that from day one. We've done that. And I know there's some people out there saying, Doug, how are you going to communicate with us? And we see you on social media, we see you on news, and how can we, else communicate? And one of the ways we're doing that is here today. But also, you have to take into account we're 470,000+ strong. I wish I could sit down with each and every one of you individually and we talk about, whatever. I would run out of days if I tried to do that. But one of the ways we can do this is these kind of questions. There are a lot of themes that we're going to develop today. But number one, I'm first and foremost for all of VA employees, I am proud of the work we do. I've said this from day one. You've heard me talk about it. That, I put veterans are first, that we're a service organization that is designed to help veterans. We're not anything else. We only have one reason, as the veteran comes to us for a service. And I think that's one of the things that's important. So for all the folks watching today, and I know we got VA employees, and we have probably some our friends in the press and some others that were joining us that got this. So look, I'm glad you're here today because I'm not going to say anything different that I've not said to everybody else. VA is a great organization. It's a great organization that can do great things, but also just like every other great organization, there's times when you have to reevaluate and talk about what we're doing. But look, your work has caused us to expand our look at community care. It's expanded our, dropping in our VBA side. We've dropped almost, we're looking at probably close to 70,000 in backlog right now. That's fantastic in a little over 60 days, almost 60 days, 60 to 75 days. We've been able to do that. We were just looking at this the other day. I think I've been to 16 or 17 states where I got to remember which one, 16 or 17 states. And I visited well over 50, almost 60 of our facilities. I visit our cemeteries. I visit our regional offices. I visit our vet centers, and I visit our VAMCs. But I also do town halls with our VSO partners, the Legion, and others where we just take questions, just like I'm doing today, but I take them directly because they're just smaller settings. These are the kind of things we're going to continue doing. I want our folks at the VA to understand that our organization is an organization that has a great purpose, and it has a lot of things to it. But also we have a lot of eyes on us. And everybody seems to want to think, well, we could do it this way, we could do it better. I go back to the simple fact that we've had a lot of issues, and I wanted to, over years, that have never been addressed. Now, we've had money thrown at us, we've had people thrown at us, but sometimes the solutions really wasn't involved in that, and it would just made us sort of feel better. Sometimes that's not the best thing. So we need to figure out what's best for our veteran and then make sure what's best for our employee workforce to make sure we service those veterans. So Ron, I'm glad to be here. Let's have a good time. And let me just say it up front, are some of you going to like my answers? No. Are some of you not going to like my answer? Yeah, probably so. But that's okay. I said this from the time I spoke, and you remember this because you were there. When I spoke to the VA employees, when I first got sworn in, I had that one meeting, and I told them we're like a family. And families can disagree. We can disagree all day long. But if they come after us, and this is, whether it be press, whether it be Congress, whether it be everybody else, and they come at us, especially with stuff that's not true, then I'm going to fight it. And when it is true, then I'm going to say, okay, we made maybe something we need to change here. We're going to make it right because it matters for our veterans. So with that, let's have a good time today.
Cool. All right. Yeah, we'll get into some of that here. As I mentioned, almost 7,000 questions, just to give a sort of ballpark for everyone. About 20% of those questions were related to potential reduction force. 15% of those are in return to office. Smattering of other questions around veteran care, transition from the military, and we'll make sure we get to this. What happened to the gifts?
So it's a big concern for everyone.
Yes, so we'll get to that. So question one that we have, and I have a whole stack here that we've pulled out. This person says, I'm a frontline supervisor, and I see the effects of possible rift is causing not just to staff, but to veterans that are afraid of losing their amazing provider or nurse. Can you please give us a better understanding on what the rift will look like and how veterans will be taken care of with less staff? I truly appreciate your transparency.
Well, and I appreciate the question, because I hear this all the time. In every hospital I go into, it seems like every time I walk into one of our VAMCs, and I've been to, like I said, we've been to many of them now, probably 10, 12 that have been, and I meet with the senior leadership typically, and I can always see it in their face. When they first go in, it's always there's this concern in the room. Who is this guy? Is he as bad as I've heard he is? Is he terrible? You know, is he going to cut everybody? And my first question to every one of these staff is, what can I do to help you? And then I say this: if you're in a hospital, and this is why I want to do this, and for all those out there who have been, on us and really upset because of things that they don't know, let's just give some facts. Number one, a RIF hadn't occurred. So for any member of Congress, and I heard some just this past week, there've been 7,000 people fired at the VA. No, they haven't. It's just wrong. I don't know why you want to make up stuff. That is just wrong. There's this, you're going to hire, and I've seen this, and I think there's even some of the questions, you're going to fire 15% of the doctors and nurses at a hospital each. No, that would be stupid. We're not going to be doing that, because this is not what we look at. So really the thing that bothers me is I spent most of my time between media reports, congressional comments, other folks, unions, everybody else, making up things that they don't know about. And that really frustrates me, because number one, has there been a decree that was an executive assigned to say, look at a reduction in force? Yes. Which, by the way, has been put on hold. There is no reduction in force happening right now because it is on hold. Now, we do expect that hold to be lifted at some point that allows us to go and look at what we may be doing. But we also put we're up to 350,000 positions right now that are exempt. In other words, they weren't even touched with probationary. They weren't touched with early retirement. They're positions that we know we have to have. So in the essence of the question is how do we make better with less staff? That's not in this process of what we're looking at. Because if you're out there working with patients, as I told these executive leaderships in these hospitals, if you got nurses, you got doctors, you got therapists, you got the people there cleaning the rooms, doing the sterilizations, those are people we need. They're not the ones we need to look at moving. But can anybody in this call also say that this organization uses everything efficiently? I have been to these organizations. I was in Congress for 8 years. I heard from employees who said, yeah, this doesn't work. I've heard while sitting in this seat, well, I can't get any information. I send stuff up or it's bureaucracy. Well, part of that is because over time, with our help from Congress, with our help from others, we've added people and we've added money to programs, hundreds of billions and hundreds of thousands of employees that in the end were added into layers. And if we're honest with each other, and this is the family, a lot of those were added at middle layers between hospitals and central office and at central office. They were added in our regional offices and in others. And what we saw was in fact, we saw an actual decline in the numbers, if you want to talk about it. So I'm just going to go straight to numbers. Our wait times were up. In fact, in the last few years, and this is something for all of our employees, especially in our hospitals and doctors, if you're listening, community care is an active part of the VA. VA care is VA care no matter where we serve it. Please quit thinking you have to keep every veteran to only VA services when we're going to pay for it in the community. We'll take care of the budget. You're going to have the stuff you need to take care of our patients. And when we're providing a good service, they want to be with it. But the law actually says they have a choice, best medical interest we just put in to make sure that happens. That's a long way of saying, if you're working with our disability benefits, you're working with our people who get the benefits they've earned. You're actually in our cemeteries, putting families at ease and making sure that their loved ones are laid to rest in a proper and respectful way. If you're in our hospitals doing the day-to-day work, then quit letting the media, unions, or anybody else scare you, because we have a mission to do. But I will say this, it does seem sort of strange that we had over 60 of our hospitals and organizations still doing their own payroll after we were supposed to have centralized that. That's hundreds of jobs. We still have contracting spread out all over, almost between 10 and 20,000 contractors spread out all over the country. None are centralized. And for most of you, if you work at this, you'll admit it, we don't do the same thing across our VA. We have some people are doing different things in one VA on the East Coast and doing it differently in the middle. We're a VA. When you also look at our human resources, again, we're not standardized. And we have people in places that can be done more efficiently, more organized. Now, does that help us get people we need? Yes. Does those in a tangential way, all go toward healthcare? Yes. But tell me any organization that doesn't look at itself and has the numbers that we had, which by the way, wait times were either stagnant or going up, community care was not working, and those disability backlogs. We were 260,000 when I took office in February. Now, some of you out there, and I hear you saying it right now, we had COVID. I grant you had COVID. It got up to 300,000 or 400,000. Yeah, but you only got down to 200, Impact Act coming in, 260,000, and we wasn't moving. It was 60,000 just at the end of 4.5, 5 years ago. Yeah, we're moving that down. So I think those are the kind of things that, how do we do that? How do we do it better? But I just want you to be assured, if you're out there working hard, you're out there doing the stuff for our veterans, you're taking care of them, then we'll do your job. We're going to make sure that our agency runs efficiently. I'll hit the big also number in the room. I've heard it from Congress now. I've heard it. The president, if you don't set a target for anything to see what could happen, then everybody's just going to brazenly do nothing. So we had a 15% target across the board on the in the federal government. Well, we're the largest organization out there. So that 83, that's where that 83,000 number comes. I have never said that is the ultimate end. I've always said it's a goal. I've always said it was something we would look at. And then we have people who leak stuff to the media, leak stuff to the Congress saying, oh, well, see here, you talked about leasing these people. No, we're doing it with career employees. We're doing it with professional consultants. We're doing it with our political folks. We're doing it with everybody to make sure we're going to make a workforce that looks as it should. And if that means it's, a small number or a medium number or any number, it means that we're going to make it better for our veterans, because that's the end of the problems of veterans.
Yeah, let's talk about that. Because I think when people hear the numbers, then it's framed as sort of indiscriminate, getting rid of things. But I think anyone that's worked at VA for any time, if you tell me that you're helping me get rid of bureaucracy and give me the tools to do my job better, sign me up. I'm there, right? So 350,000 exempted. For the rest, how is VA determining what, and this is a question that came in, how is VA determining what non-patient facing roles would be impacted? How are we determining that? I heard you say a little bit. And then how are we measuring if there's an impact to veterans or not?
Well, I think you always look at, and that's why we're not doing this ham-handedly. That's not why you've seen there's other, I've been accused of, just slashing, and we've not done any of that. This is taken, in fact, we're still in the process of looking at what a model force could look like. Judging, this is another thing that's often misunderstood. We're the largest healthcare group in the country, but we also do things on different scales. Now, before anybody says, well, we deal with veterans, that's our unique special part. They do have special needs, but the vast majority of our healthcare is the normal everyday needs that anybody goes to any place else. So, we need to look at our workforce in the situation of saying, is it properly sized? And I think, so how are we looking at that? Is the positions contributing to an overall more efficiency in the workplace? Could our money be spent better? Could we do it in a way that puts money toward the real reason we're here, which again is for veterans? And I hear some people talk about that and they say, well, Doug, that's always been true about veterans. Has it really been? If so, then why is 60% of the calls to congressional offices about VA? Why are people picking up the phone all the time talking about, here's what I have? That means that sometimes everybody is upset and they just have Congress to call. I want it to get to the point where there is no reason for them to call, that we're doing the care that we have in the best way we can, in a way that is pleasing to the veteran who we're serving. But also the way we standardize looking at this care is, are there things that would be nice to have, if you would, or are there things that would be better efficiently served in a much tighter way at the VA? So I'm not going to get into, one of the things that I've done is, I've not done it for Congress, I'm not going to do it here today, is I'm showing you examples of where, as I did earlier about with our payroll, but it's not fair to you as an employee. It's not fair to others to say, here's the groups that we're thinking about, and then but we change. That puts more fear out there. I'm just trying to say, do the job. This is a way that we can look at who we are as a organization and take care of our veterans at the same time.
You mentioned, part of more efficiency and things like that. That's not just cutting. That's also adding things to different areas or focuses. How do we plan to balance cost cutting through layoffs with the need to hire specialized staff to address veteran wait times and backlogs?
Here's an interesting thing: is we're not balancing budgets, and I think if anybody has a look at it, we're not balancing the budget. In fact, the president actually increased our budget 4%. If you take into some TEF funds, it's actually higher. We're not balancing our budget on cuts. Many organizations are saying we're going to cut and we're going to use, we're going to cut these many people, and that lets us decrease our total budget. Right now, we're looking at how we take this and move it forward in a sense of using the funds to better allocate toward research, toward taking care of patients, toward lowering wait times. There's also this fallacy out there that we're not hiring. Every 2 weeks, we hire close to 1,000 people in the VA. Those 350,000 positions are ones that we are hiring in, not just in the healthcare and VBA, but also NCA as well. We're hiring all the time. Specialty cares, those kind of things. If we have a need in our facilities and we have that, we're going to try our best to hire those people, or we're going to use community care to supplement that so that the veteran is never left without. But I also have to be honest, Ron, and we think about this for a minute. We're a healthcare organization. Anybody watching me right now, I would challenge you, tell me an area where your public and private hospitals don't have the same challenges. Don't have the same challenges of hiring nurses. Don't have the same challenge of hiring LPNs. Don't have the same challenge of hiring housekeeping and food and canteen workers. They all have the same issue. But also I have a little bit different issue too, especially from my specialty doctors. I'm capped in pay.
Yeah.
I'm there's some things that we just can't do. I've already asked, just for you out there to know, I've already asked Congress to take a look at that, raise this cap so that we can hire doctors, nurses, these kind of things, that we can be better competitive to the world around us. Those are the kind of things we got to look at. And for me, it's about making sure we have a good workforce, making sure we're hiring where we need to. But we're going to use every tool necessary to make sure the veteran gets taken care of.
Moving down the list here. VA has invested heavily in mental health, suicide prevention, and homelessness for nearly 2 decades. We've talked about that a lot.
Yes.
Yet outcomes remain troubling, according to this person, especially for veterans outside of VA care, which is something we work on a lot, I know. Under your Veterans First vision, do you plan to continue the current approach, or is a change in strategy, structure, or partnerships on the horizon? And if so, how?
Wow, yes. And I mean this with love. We have spent, and hopefully some of these numbers you're hearing today, and if you're watching me for the first time, I'm just fairly open, transparent. Our budget for the last few years has been around $580 million for preventative aspects of suicide or death by suicide. $588 million this past year. We've done this for several years, so it's well over almost $2 billion. And yet the number since 2008, 17 to 20, 22, however you want to look at it, has not changed for our veterans. We're still losing that many every day. We're losing them in our hospitals right now. Many of you who are watching right now have had a veteran commit suicide, unfortunately, on our property. I've had our great police force who go out and have to deal with this firsthand. I've seen our doctors have to be out there firsthand. I've seen our first responders, our chaplains, and everybody have to deal with it. I don't want to see this continue to happen, and we're not going to continue to do it the same way. Something tells me, and when I go out and talk to veterans, they're not getting impacted because, again, 50% almost, 40 to 50% of those veterans have not been impacted by VA. In fact, we don't have them in our system.
Yeah.
So what are we spending the money for? Is it to make us feel better that we're doing something? Because if we do this for many years over and over and over the same way, we're helping some who go through the normal processes. But what about the folks who don't respond to us in the VA? And right now we got a younger generation, the GWAT generation. Some of them are coming to us, especially if they have catastrophic injuries and others, but some are just not there because they've heard so much that they don't want to be a part of the VA. So we're going at it. What I'm looking to do is redefine how we're spending money. We're going to go out and we're going to partner with our nonprofit partners. We're going to partner. The VA is going to be actively involved in outreach in areas in which we're actually reaching veterans where they are. That's why I'm doing podcasts. Many of you knew I was on the Sean Ryan podcast. I've gotten many responses from so many of you about that. Cam Haynes. We're doing a lot with our military influencers. I'm going on, any interviews. I'm going on, places with partners from not only from our singers, our songwriters, our movie folks, NASCAR, UFC, whoever we can do, the NFL, to get to people who don't normally just walk up to our VA or our vet centers. We've got to rethink how we do this. And that doesn't mean that the people who've been or where we've been at is necessarily wrong in the sense of they're not trying. I think it's just that we get so used to the rut of doing it the same way and just putting out the same white papers and saying, well, maybe it'll get better. I just don't tolerate that. If we can make a difference, then I'm going to try and make a difference the very best way we can using any means necessary. Because when you also spend $2.3 billion in treatment, which is what we do, and $588 million in prevention, and you're not seeing numbers change, I challenge anybody watching this today. to tell me that we need to just keep doing what we're doing. If we're doing that, that to me is just not a good way to do business.
Okay. You touched on this a little bit in your opening. This person asks, I often hear the frustrating response, we don't do it that way here, or if you've been to one VA, you've been to one VA. When seeking process or policy guidance from other facilities, could you discuss attempts to unify facility operations, moving away from these siloed approaches?
Oh. All right. Well, we're now at the end of the rest of this town hall, because this will be the rest of the town hall. No, right. You have hit something here that it amazes me. I'm freely admit, I was a member of Congress. I've been in the military for 23 plus years, Air Force. I was in the Navy for a while. I've been a state legislator. I have never in my life, even as a member of Congress, hearing the complaints that we used to get and the need for help to the VA, I never ever would have thought it was as siloed as it was when it got here. Mm-hmm. I had a veteran come to me the other day and say that they were in a facility out west and they were getting a certain treatment and working with I think also prosthetic, but they're working with a treatment that they've been getting for a while. And they moved to a facility on the East Coast, and the East Coast facility said, the VA doesn't do that. And the veteran looked at him and said, I just was at X VA, and I'm trying to leave this out because we got everybody here. I don't want everybody, it's my VA. No, we're not going to talk about that. But they said, we don't do that. And I looked at him and I said, you were at a VA, right? He said, yeah. I said, so they told you the VA doesn't do that and you know that they full well do? He said, yeah. I found out that we have 170 plus different ways of doing things at 170 different hospitals, all with a VA logo on. I am just stunned that we don't have standardization. I'm stunned that we don't have standardization of purchasing, standardization of hiring, standardization of protocols. I've been told, and again, we're looking into this, and we'll never, jeopardize things that we have to do. But 170 different procedural and bylaws for every one of the VA. No, why? And if if it's part of a joint commission, fine, we'll deal with that. But again, it should be at least be uniform, even if it is. Mm-hmm. Are there quirks to some of our facilities? Yes, but you don't deal with them that way. Here's the thing that I would like to see. The comment you made that if you've been to one VA, you've been to them all is the greatest lie there ever is. That's just not true. VA's emblem may be on the side, but until we actually operate in a way that captures our greatness, captures our efficiencies, and does it all across this network, we're simply 170 plus standing alone and trying to do it on our own. And that's not the way we're budgeted. That's not the way we're made. It's why our veterans get frustrated, because one says we can't, one says we do. It's because it's one of the reasons why our health records management system, which was started in several years ago now, mainly in Washington State, 6 sites. So I think we just added another one, but 6 sites that basically did not work because each of the locations was given the ability to basically customize their own plan. That's just that just shouldn't have happened. We wasted billions of dollars doing that. So going forward on our health records management system, there's going to be standardization. Everybody's going to look the same. So if you have one doctor can go to another, there's no wondering why does this look differently. It saves us money. It helps our customer, which is a veteran. It makes patient safety a priority because nobody's wondering how the system works. But why we would ever have allowed us to develop in silos like we are really goes against any modern organizational structure. So for me, I'm every day looking at regulation, looking at our rules, looking at our policies, and looking at statute to say, how do we do this better? I hear this all the time in my office. And it started off that I get this answer some from the organization say, well, sir, it's statute. And I say, okay, I'm a lawyer. I'm also been a member. Show me the statute. Crickets. No. Well, I said, no, show me the statute and I'm okay. If we need to change it, we'll go to Congress to do that. And then it typically comes back down to, well, it's not the statute, it was policy. Well, policy we make. Policy we can change. If it's not working, you change the policy. There's no, grand room in which we keep the policies chiseled in stone that they're never to be changed. And so I want to encourage you, here's your first homework from this session today. If you see things that aren't working, send it just like you sent to this. Send an email. Say, look, this isn't working. Why are we not doing this? Let me know what we can do. Because what we have found in my visits, we've changed things. Credentialing and privileges are changing so that we can we can go into a hurricane season and we can pass doctors and nurses and patients back and forth in a matter of an hour or less in between our facilities, say in Florida and Texas, instead of it taking a day or 2 days when they were actually having trouble with this. This is stuff that I heard directly from the field. We're continuing to hear this. Make it easier. If you have a way to make our processes easier, I want to hear about it. Because we cannot continue to operate as if we are individual organizations operating under an umbrella of somebody in Washington, but yet we're all on our own. If we're going to be the strength and the power we need to take care of veterans, we've got to be under one silo, and it's called the VA. And the VA has a health administration side, it has a benefits administration side, and it has a cemetery administration side. That's it. That's the three silos. And they all come under the secretary. We've got to get better at this. We've let it go for so long, though. Here's the problem. And I know, Ron, you've been here a long time.
2 years.
It gets easy. It gets easy just to drop back into the same rut. I grew up with a granddaddy who had a dairy farm. And what I loved about that dairy farm going down there was I could always just walk out in the field and I could look. And I always could follow the paths where the trucks were going or the tractors were going. Because after a while, they used the same path. And anybody's been on a farm knows what I'm saying. Yeah. You have the wheels, and you have the middle part where the grass was. You can always follow it. And if you got off, it was a little bumpy until you made another path. Folks, we've gotten too comfortable with the ruts. And now it's time for us to say, this rut is good. There's a reason we're in this rut. Or maybe there's a reason we need to get out of it because our workforce is changing, our people are changing, and our veterans are changing. And their needs, how can we best do that?
I like that. Yeah, I've been here a while, and we've had it various. I remember when Mission Act came in. The one thing I will say, about the workforce that I've experienced is when those challenges are given by leadership, people are usually all in.
They are. And look, I don't want this ever to be a thought. Yeah. And look, my words get played, and I'm used to it. And that's okay. I'll tell anybody, especially the ones out there right now who are just watching this to see how they can try and attack me. Go ahead. You attack me all day long. Yeah. Okay? But I'm going to still fight for this workforce. I'm going to still fight for our veterans. You're not going to get me off track. And I think that's the part that we all got to come together and make sure this happens. Mission Act, I want to go back to we'll just take off what you said. Mission Act was brought into play because of issues that we had with scheduling and appointments and scandal, basically, that rocked this community. I was in Congress when this happened. I was in Congress when we passed the Choice Act, which was the predecessor to the Mission Act. And we've made it better. I've unfortunately watched also us go away from the Mission Act. And then I hear this all the time, and I'm going to go there. You've watched me do enough of these. We get this idea that, well, we got to be very careful about the community because we want to make sure that the care they're getting out there is VA care, it's quality. I want us to be very careful about how we word that. And I've talked about this in some of our VAMPSs before. So you're basically telling me, with sometimes not a lot of reason, that the doctors in your community are not good. You're throwing all your doctor colleagues under the bus, and the nurses and all. Well, that's not what we're saying, but we do it so different. Okay, if we do it so differently, then we acknowledge that and we show it. And it's also shown by our veterans don't want to go anywhere else. Sometimes we got to be honest with ourselves. Maybe they want to go where it's a little bit closer. Their best medical interest is with those other doctors closer to home. Not because they don't like the VA, but because it maybe has been their interest to do that. The Mission Act was designed with that in mind, to say, how do we best serve the veteran? Not the VA. The VA will be here. And I think there's a question about this. I may just jump ahead and get this one out. Everybody says, we're going to privatize the VA. No, I'm not. I couldn't if I wanted to. but I'm not wanting to, because the VA carries such a tremendous asset and role in our community. There are things that we do better than anybody, from prosthetics to TBI to PTSD care to I mean, just going into prostate care. There's so much we do so much better at times that people send to us. In fact, DOD floods us with their people because they can't do it. I don't want to change this. I want to make us better. But we've also got to understand that we are not the insulated monopoly that sometimes we're made out to be. And there's been and I get it, because I hear this is the undercurrent. Well, if we don't, show that we're doing a lot, we're gonna lose money. What are we really saying there? What we're really saying is we're more concerned about us as an organization than veterans getting the care they need. We do our job. We'll never have a problem making sure that they get what they need. And we'll have it in a more efficient, more effective way. And I'll go back to something I said earlier. If you're out there and you think, frankly, you think that the VA is perfect, then we got a problem anyway, because there's no organization perfect. Everybody can improve. That's all I want from you. All I want to give you. I want to be everything I can to help you. And if you can, know that I am on your side. We wouldn't have exempted positions if we want to get rid of everybody. We wouldn't have done these kind of things. We wanted to make sure that veterans care is taken this first in priority, and make sure an organization that fits us. Now, we have differences how we get there, but we're going to continue to do that. So this Mission Act, accountability, I'm got a real word for you right now. If you're out there and working in our workforce and you don't want to be there, please find another job. And I mean it with love, because if you don't want to work on our veterans, who are the best in the world, then it's not good for you and it's not good for my veterans. If you're out there doing stuff to harm my veterans, you will no longer fail up in the VA. There's no longer going from one position and we're just going to fail you up to go do an administrative role. No, you're going to be administratively out. Accountability matters. Good people will not work where bad things are tolerated. They won't. And so what we've got to do is make sure we have a workforce that is properly trained, properly executing, and doing what they're supposed to do. I get that the RIF, we started off with this. We started off with the organization. It is concerning. I get it. And especially when other people lie about us. See, more so when they say we've already fired 80,000 people, when they say we've already, no, we haven't. So I'm just trying to maybe calm the nerves and say, keep doing the job, and we'll see what happens as this thing goes forward. But right now, again, if you're taking care of our patients, you're taking care of our disability claims, you're doing the things that we do to need to make this organization work, that's not a worry for you.
I think the message of, keep doing what you're doing if you're doing great, because again, if you tell people you're going to eliminate bureaucracy, they get on board to those sorts of things. If you tell people accountability and stop seeing people fail up, I think the majority of people are like, sweet, let's do it.
Well, it is. Well, I sort of think this. I mean, because you look at it, because there's an old saying and I learned this from leadership lessons a long time ago with a guy named John Maxwell, and it's about a team. We're all a team here, but if everybody's not pulling their own weight, then you get upset. And Maxwell used this old analogy. He said, it's like a baseball game, where you hit the ball and you drag George. You hit the ball, drag George. Hit the ball, drag George. Pretty soon you just want to hit George. Okay, and that's what happens in an organization. Is you get frustrated if the team members aren't playing together. We need to encourage everybody to play on a level that helps our veterans, and that's what I want to give you and empower you to do. Is to do that. Let's talk about the red tape kind of issue, which basically came from veterans, by the way. If people didn't know where red tape came from, it came from veterans 100 years ago when they brought their concern. They were tied in red ribbon. That's how that came. But one of the things we talked about is I have a daughter who has spina bifida. She's in a wheelchair, and it's always aggravated me to no end that the Social Security Administration would call us about every year, and she's now has a full-time job she's working at, but they would make us every year basically say she still was paralyzed from the waist down. It was infuriating to me. I said, well, this side of heaven, she will not walk, barring a miracle. And then I heard it from some of our veterans who I was meeting with one day, who were double amputees, who were talking about having to go to their primary care, then to OT, then to PT, then maybe if they did another consult, to then get to the seating clinic to get a new chair or a new prosthetic. I said, why are you doing these? They said, well, that's the way we always do it. So we're putting into a process right now, and hopefully it's going out. If not, it's already there, a primary care can just send directly to the seating clinic. They don't need to go through 3 other things. They're already in the system. They're already a double amputee. They don't need to have everybody touch them. Our VBA form. Why is there a form in our VBA paperwork when you initially apply that basically asks you to give most of your military history? The first page has all we need. Name, your date of birth, your DD-214 number, your social security number. It's all there. That's all we need to find your record for the most part. Unless you're one of those that got lost in 73 and mine, I get it. But for the most part, that's all you need. Why are we making them go through this? And for an older veteran or a veteran who's in a health crisis to now have to apply for the first time and have to try and find all that stuff, thinking they have to find it. That's why they think they have to go get help to do it. We should never be an organization that veterans have earned benefits that they feel like they have to go get somebody to help them access the benefits they've already earned. We should never be a part of that. It should be easy.
Shifting gears, I mentioned return to office.
Yep.
A lot of questions on that. I know that's been something my family's been juggling, myself even. Will there be any consideration, this is generally, there's a lot of people that ask this, to RTO mandates for those that were hired with the offered benefit of working at home or tying it to performance? If you're an outstanding performer, is there any flexibility coming back there?
There's been flexibility, but let me just also say, we believe that the best workforce is one that is together, that is communicating together, that's working in conjunction there. If there's unique situations where they were, there was a specific benefit or something, then those need to be looked at. And by the way, all of our frontline supervisors have the ability to look at those requests. But one of the other things I also want to make aware of, if I know, we have exempted folks, and especially in certain career fields, and we've also exempted some who had issues that are going back. We're not in COVID anymore. This is where a lot of this came out of. And so we're also bringing people back in. But contrary to popular opinion of the media and people who want to agitate issues, and I'll just put it at that term, if you're not going to be brought back to work if we don't have a proper facility for you, if we don't have the proper precautions or whatever you need to do your job, you're not supposed to come back. If you've been put back in one of those positions, then that is the supervisor all the way up to the head of the department is against our policy. That is not our policy. In fact, we've made sure of it, and we go through. So again, this idea that we're putting people in places they shouldn't be, if you're in one of those, then let us know, because that's a supervisor issue that's going to be handled at that level, because that's not what is supposed to happen. That's not our policy. So we're doing everything we can to get our workforce back together. We're making exceptions where we can and needed more than anything. But we do believe that overall, and I see part of that is also some coming from some of what we've seen from our backlog claims and other things that have been coming down. We're seeing good things. We've had more productivity after return to work. This is daily in VBA in particular than we had before. Anytime. Higher numbers per day. We've been hitting records consistently.
Okay. Next up here, well, we already answered the privatization question.
I get that all the time.
Still a no.
And for all the senators and senator staffs who may be watching and House staff, no, we're not privatizing the VA. Next.
So this question is around morale. A lot of the swirl and everything, especially as a leader, you sort of managing, people are concerned.
Yeah.
And we saw that in the questions. This person says, Dear Secretary Collins, employee morale is declining with workloads, limited resources, and pending organizational change. Additionally, redirecting VA resources to community care providers threatens care quality. You touched on that a little bit. Could you outline plans to potentially boost morale, secure adequate funding to support our staff and veterans? And I won't leave the person's name.
No, and that's fine. And I appreciate the question, but I also just have to ask the question. When we have adequate resources, this person may have hit something whether they realize it or not. Adequate resources. Explain to me how in the past 10 years, our veteran enrolled number is at 9.1 million. Utilization is up in certain areas, basically based on age and need as an older veteran. So up a little bit. But 9.1 million has been our baseline enrolled number in our healthcare. But in that 10 years, we've increased the budget well over $100+ billion. We've increased our workforce upwards of really over 100,000 employees. And yet we're still discussing resources. We're still discussing inadequate resources. That it may tell me, and this person has made the actual discussion for looking at our money utilization in our workforce, in the things that we're doing, to make sure we're spending it the right way. Because I made this comment to the senior leadership here, and I've made it in some of our hospitals. If you would have told me 10 years ago, if I'd have sat there and told you, here's what the budget for the VA would look like, here's what the manpower would look like 10 years ago, from then to today, that group 10 years ago would have thrown a party. We're going to make it. We're going to be the best. We got everything we need. 10 years later, same problems, same issues, but yet we have all these more resources. Now, someone's like, well, this is packed and everything else. Yeah, it's true that some of the veterans are getting more benefits than they were getting. That's where some of that money goes. But also, when we look at it from a perspective of utilization, we are seeing some utilization more, but some of our facilities are not seeing as much utilization. We're having a transition of utilization from some of our areas in the country to other areas of our country. But yet, we're not closing facilities. I don't have the ability, for those of you out there who say, well, the secretary is going to close this hospital. I don't have the authority to close the hospital. The Senate, who passed unanimously, the Air Commission, unanimously, and then quietly over the last few years decided just to kill the whole project. After they voted unanimously saying, we need to do this, I thought that was rather interesting. We don't have, utilization issues here. So what we're trying to do, and what the question I think actually is, morale is important to me. I want you to get up and come to work. I can't say it any other way. Quit reading the stuff about this, lying about what we're doing, and say, here's what I want. I want you to be the best employee. I want to give you the utilization. But sometimes if I don't have the resources, then why don't I have the resources? Are we spending that money in contracts and other places? We don't need to be spending that money, and redirect it with the help of Congress and the help of the president to say, this is where we need to put the touch point on. If that's not something we can all gather around, I'm not sure how I can help some who just want to basically say this is a problem and it's not getting better. Morale also is a workplace in which people are encouraged, rewarded, given the salaries they deserve, given the workplace they need. That's what I'm trying for. I'm trying to give you the workplace you deserve. I've got an aging infrastructure, 60-year-old hospitals out there that I can't fix. You know why? I don't have money. Now, you talk about a resource issue. For all of Congress's discussion, and I'll just be, they're good friends, but for all of Congress's discussion about, I need a new hospital, I need a new this, put it in the budget. We'll spend it. We'll build it. We also got to figure out a better way to spend those, by the way. It should not cost $1.6 billion to build a hospital. Not when the private industry can do a same size or bigger for half of that amount, and also half the time. We got to also look at our contracting and how we do that. So for me, I can't say it. I'd love to for all of our frontline workers, for all of our work, I want to give you, just reach out and say, I'm proud of you. The secretary believes in you. And I want to cut through all the stuff that keeps you from being able to do your job and to do it better and make it to where we have a time together that influences our veterans, influences our employers and employees to where they feel like that they are valued. And if you don't hear from me today, I'm sorry. I'm trying my best to say, look, we're trying everything we can to help you. And I'll also remind you, there have been people in the past who've promised you a lot of stuff, but at the end of the day, you're still discussing the same things, and we're still seeing results that wasn't meeting the veteran need. And we're an organization that only has one clientele, the veteran. That's it.
This one was my favorite question as I was digging through them. They asked, when you think about the future VA, when all the dust settles, and the reorganization and things like that, what do you hope veterans, caregivers, survivors will notice about the experience that is different than what they experience now? Same question for employees. You were touching that a little bit. What will we experience differently in this new envisioned system? What is your vision over the next couple of years?
I want employees to have the best that they can to take care of our veterans. I would go into the health records management systems, that they have computers, they have a records management system that allow them to take care of their patients, get the information in quickly, make sure it's accurate, get their workload down. I want to make it to where our primary care physicians are not weighed down in paperwork. Instead of being able to take care of patients, they're weighed down in paperwork with prescription refills, with referrals issues. I want to remove that from our primary care, because I'm actually very concerned that some of our primary care physicians are being put in positions they should not be put in on these referral issues and return referral. We're actually looking at extending out referrals. I want to get to a point where we realize our community partners are not our enemies. Our community partners are what Congress and others have said we need to be partnering with to make sure our veterans are taken care of, that we actually partner with our communities. I'm looking to actually, as we go further, to have our CBOCs and our rural hospitals be able to communicate and be able to help each other with benefits for not only our veterans, but also the community as a whole. I look for veterans who are able to come in and actually say, wow, wouldn't it be great to have a veteran come in and say, that was easy. I got my benefits. I got my paperwork. I got my appointment without having to go through 3 or 4 different times and having to have people not understand. Wouldn't it be nice for our community of veterans and veteran employees, our VA employees, to see a healthcare system that's striving the best it can? Will we ever be perfect? No, none are. But when we get to that point where it's a great place to come to work, veterans want to have their healthcare come, they tell their friends that healthcare is there and that they're getting a good deal, that they earned it. But then there's the last part. I want us to be an organization that has focused on those most vulnerable to us. And that is those that have come to the point of wanting to take their own life, those that are living without adequate shelter. And I would love to see them reduced as much as we humanly possibly can, because we're spending and doing our resources properly to make sure that those veterans who gave so much to us are not in a position where they feel like they're left alone.
Amen to that. Again, switching gears, you talked about employees where they get their tuning in and getting their information from. Yeah. I know there's one that you're very anxious to talk about, and then this story broke during the question period, so we got a lot on it.
Yeah,
that's the article in The Guardian from June 16th about VA doctors allegedly refusing to treat Democrats or unmarried veterans, unquote. Says that doctors and other medical staff can be barred from working VA hospitals based on their marital status or part of union activity. You sent a message out earlier today, staff. Yes. I know you want to talk about it here too.
I do want to talk about it. Anybody that's seen this is the Guardian's, journalistic standards actually are so far below the National Enquirer where they'd have to look up to find them. It is ridiculous. This is nowhere close to reality. It's false. This is almost like just lying about somebody and saying, well, prove I'm not lying. Well, no, this is not the way this works. They put out an article that they were told was false, that it was a lie. Don't do it. This is it. They put it out anyway because their ethical standards of that are of a gutter rat. They put it out anyway. The next thing that we have is we have members of Congress actually tweeting about this, asking about it, after we had already put out that it was false. It's my understanding we even have a governor who undoubtedly has nothing better to do with his time than read false information. And now want to talk about it. It's false, but here's my scary part. And this is for the Guardian and for anybody who out there actually helped perpetrate this lie. Have you thought for 1 minute about the veteran who may look at this and not know the difference, that chose, maybe I don't go to the VA. Maybe I don't pick up the phone and call 988. That's on your hands. That's on you. You may get a cute idea that you're thinking his story is that we're keeping people off. Between the numerous laws and policies that are all in place that keep this from happening, I'm tired of the cuteness. I'm tired of the lies. There's no need to talk about it because it's a lie. Yeah. But yet when you have that kind of people promoting this kind of crap, it hurts not us. It doesn't hurt me. It doesn't hurt the VA and organizations because we know what we're doing. But Ron, it may hurt some veterans out there who don't know that, or their family member. And that's unforgivable, because I will never be able to put a price or a quantity on who they may have hurt. I hope they're happy with themselves. I hope those members are happy with themselves to get a cheap political point that they think they've made by propagating a lie. Sick of it.
Transition off that one. More in the lane of you're still a chaplain in the Air Force and such. We did get a lot of questions from folks in the chaplaincy.
Right.
And so one of them asked, where do you envision chaplaincy developing as VA mission does? For example, growing to decrease the number of veterans who die by suicide. How might you convey the importance of including and engaging chaplains across VA? At times, chaplains are still on the outside looking in simply because there's ignorance about their capabilities.
Exactly. Look, let me hear it, because I know there's a lot of leadership across the VA, especially in our hospitals, listening to me right now. If you are not incorporating your chaplains into every aspect of your facility, guess what? You're not doing it right. And I'm gonna make sure that we're taking care to make sure that our chaplains provide just as well as our mental health, our spiritual, and our physical well-being for our patients. You know, I go in, I meet with my chaplains most at every one of the hospitals I go to. And some of them have actually said we're not being incorporated like we should. I want to know why. Why are we not including? And another way, let me explain a chaplain to you. A chaplain is not there, to be anything except a counselor and a spiritual helper, guidance, if you would, to have spiritual moral guidance to a person of faith or no faith. They're not there because they're a Baptist or a Catholic or a Lutheran or a Mormon or a Hindu or a Buddhist or a Muslim. That's a Jewish chaplains. That's part of who they are. That's the integrity of who they are. But they're there for all, just like in the military. We're there for everybody. So I want them incorporated in everything. I want them in not only just the normal visitation cycle, I want them into crisis care. I want them into mental health care. I want them partnering that in a crisis response team, that they're always a part of that they're in a mental health response team. I want them always to be a part of that. And we're going to make sure that they have the resources they can to do that. My chaplains out there, thank you for what you do. Keep it up. But also to our administrators, if you're not using our chaplains in the way that they should, then it's time to reevaluate your situation, because I will find out and we will make that adjustment.
Okay, I promised I would get to this one. It's a very pressing one that's come through. We all woke up this week and gifts were out of Microsoft Teams. As an elder millennial, this is how I communicate with everyone. I'm a little at loss. What's going on? Did you take away the gift?
Well, as an older ex, it's not really one that actually fell into my gut, but it's terrible. Yeah. You can't, as someone who's been made a gift on many occasions and probably will be made again, you're taking my platform away. Come on. No, I mean, really though, I'm more of a meme guy personally, but we will send those. But let me just also say, it's not just VA. We didn't do this to ruin your fun. This was across governmental platforms, not only the federal level, but state level as well. This was Microsoft. So Microsoft, the votes are in, they're looking for some gifts there, but believe me, I'm accused of a lot of things. I do a lot of things, most of it of which I don't do, but this one I I didn't do this one. So, we're just there.
Okay.
I share your pain.
My reaction was to send a boo gif, and then it wasn't there.
Oh, I got several I can send.
Yeah.
I want to send most of those every day.
Right.
They tend to tell me not to.
That's fair. It'd be an interesting FOIA.
Oh, yeah.
Questions came in a lot on the research and their role in VA going forward. I know we do a lot out of the studio with the MVP team and things like that to promote VA research. This question is, what are your plans for VA research moving forward? The research teams have been instrumental in improving veterans care, and it would be great to know how their work will be supported and recognized.
Yeah, we're going to continue it. I believe in our research. We do some of the best research work and very specific research work. There's been a lot of discussion on contracts, and please don't, again, read and believe it. A lot of these contracts are, and a lot of our research is on a rotating basis, and some are being renewed through other means or other assets. We're wanting to keep all of ours going. One that I'm very particularly proud of is our research into the psychedelic issue. In fact, I was just at the Bronx just the other day discussing MDMA therapies, which have been phenomenal in working with those with PTS and traumatic brain injuries, these other issues that we have. I know there's some others going on that are around. There's about 11 or 12 in the VA right now. So that's the things that I see, research being able to provide not only but also encouraging us to find not only things that will help veterans of the future, but also that will be helpful to the general public as well. So research, I believe that education is the magic bullet for all of us. The more we know, the better off we are. And I want to see that continue to happen in the VA.
Terrific. Dear, at least to my heart, we got a few questions on this, and I saw Secretary Hegseth over here.
Yes.
With you up in the office. This person asks, what plan does VA at large have to improve service member transition and cross collaboration between the VA and DoD?
Oh, that's a great question. This is good. It's one of the reasons why I really enjoy being a part of this cabinet, because a lot of us have worked together, or we've been members together before. And I've known the Secretary of Defense for a while. And one of the things I first talked to him about before either one of us were actually confirmed was that there's an understanding of what happens in DoD affects VA. Mm-hmm. And what happens in VA affects DoD. If you have a system in VA which people don't think they're getting their benefits and they're not getting the help they need, then they're not going to tell their kids or grandkids or nieces or nephews to join the military. The same way with the DoD. So we're sort of back and forth here. So what we determined early on was that we needed to work together. So we had a meeting at the Pentagon and a meeting here where he came here, and we signed an agreement, memorandum of understanding, that we're going to work on transition and utilization of facilities. How's this going to work out? One, let's take the facilities first. There are facilities within DoD many times that are not as full as, or not being utilized in a way that is because they just don't have the numbers that maybe VA does, especially in some of our towns, especially in the South and others. So we're actually working with them, so we're going to be able to open clinics. We're going to be able to open bed spaces in hospitals on DoD facilities, and actually use DoD docs and VA docs to come in to be a part. That keeps their readiness up, and also keeps our docs and it keeps our VA healthcare continuity wise. The other thing is, and then almost the other part is transition out of the military. Mm-hmm. Right now, I don't think there's anybody in the military's realm, VA realm, or anywhere else that would say our transition is working really well. In fact, it's not, and we just don't acknowledge it a lot of times. But I did tell the Secretary of Defense, I told Pete this, I said, Pete, here's the problem. You own the program and I get blamed for it. Mm. So I said, if we're going to get blamed for it, we need to be more of a part of how do we actually make this work. And you're going to see more of that coming in the future, that we're going to hopefully take some more responsibility for making the transition out, especially with our warm handoff for those with mental health issues, multiple injury issues, that we basically take them straight from DoD straight into VA health in a very seamless transition. There's been a lot of discussion on just signing the veterans up into VA healthcare as they come out. Those are things that we can all look at.
Yeah, I can say as a communicator, we're forever chasing once they're out of DoD.
Yeah,
you find them, right?
Yeah, you just chase them.
And that's a struggle. So that would be amazing. We have just about 2 minutes left.
Okay.
So I'll ask a couple, what I think would probably be short ones.
Yes.
What efforts are we? I love it. The last one, I think it will. What efforts are being made to improve recruitment of physicians and other physicians? You said that we're still hiring 1,000 through ours.
Yeah,
that's a commitment that we're going to do to keep.
Oh yeah, look, there's not all those physicians exam. We're hiring them every day. I'm actually working. I've tried to get members of Congress to help us with the pay cap issue and others. And if we can do that, that'll help us as we go along. Because look, I think the veteran and the VA is a great place to work. I want to be able to bring people in and they not feel like they have to sacrifice. I know I was reading through some, the questions as we were looking at these. Well, and somebody actually said, they took a pay cut to work for the VA. I understand that. Yeah. But I'm proud of them and I appreciate it. We want to give them the best workplace we can.
Yeah, the mission goes only so far. You got to exactly pay them too. And so the last one, this has been terrific. I think people will enjoy hearing from you directly and things like that. And so they just ask, and there was a couple of these, can we do more of these, regularly dialoguing? Yeah. That a lot of folks aren't paying attention to social media or things like that. They're trying to turn it off.
They actually get up and go to work and take care of their families and don't live and die on a news cycle. Wow, that's an amazing concept. Yes, we're going to continue to do these. And also, if I'm out and about, one of the things, if you've been in a facility where I've been, I don't stick to the script I go see people. I see our veterans, and I go sit down beside them in the weight room and talk to them. And if you see me, come up to me. I would love to talk to you if I'm in your hospital or I'm in your regional office. I'd love to talk to you.
Terrific. Any other closing thoughts before we?
The only thing I'll say is this: look, it's been great. My time, I've been almost 5 months now. I love my VA employees. I love my VA workforce. Does changes possibly going to occur? Yeah, we're not there yet, but they're going to be done in a thoughtful way. They're going to be always done with the emphasis on that earlier question to get resources where resources need to be, people where people need to be. But then at the end of the day, it's about one purpose and one purpose only, and that's our veteran. And if we're doing that, then we're going to take care of all the rest. But I just want to encourage you, keep your head up, keep going. Change happens. Change is always uncomfortable. But the change we're happening so far, it's been amazing because everybody's accused us of a lot. And nothing's really changed in the last few months except people wanting to foster issues. Let us get to the point of saying, hey, we're going to move forward. We're going to give you the answers. And that's what we're trying to do. But I appreciate them all. And I thank them for watching today.
Yeah, thank you for being here. That is all the time we have today. On behalf of Secretary Collins and the National Broadcast Team, I'm Ron Haskell. Thank you for submitting your questions, and thank you for taking the time to watch today. Be well.
All right. I give you my thoughts, and I'm going to go to bed too. So, I'll be real with you. I think that was useless. There was one thing I did take away from that is the VA secretary is aware. And I think it's good for him to say too that VA facilities, the over 100 of them, operate autonomously, which is not good. All right. So for instance, my VA healthcare teams in DC, they're pretty good. They've been bugging me lately, but generally speaking, they're pretty good. Where someone experienced in like Hampton, Virginia, especially recently, would not be so good, right? I can tell you this. I can think of 5 questions that I've never seen anyone ask a VA secretary. I've been trying to hammer these questions since McDonough. All right. I guess it's not that long. Haven't been out that long either. But yeah, that's all I got, dude. My wife was mad at me. I even came down here to do this. So on that note, I got to go. Thanks for coming. Appreciate it.